So last week, the European Commission launched a brand new food fortification mapping. This was based on the 2014 commitments made in the EC Plan of Action for Nutrition, which had three strategic priorities. The first one was increase political will. The second was scale up action at the country level. And the third was to mobilize knowledge in nutrition. And the nutrition plan talks about two objectives that would leverage those three strategic priorities. One is stunting reduction, and the second one is around iron deficiency anemia, actually reducing anemia. So it was in this context that the European Commission contracted Land O'Mills and the Global Alliance for Improved Nutrition to undertake a global mapping on food fortification. Right, so there were 7 takeaways that were identified. I'll just speak to 3 of them. The first one is that this is a population-based intervention, but it has great contribution to target groups. So biofortification, large-scale food fortification reaches everybody, but also has high contributions to women of reproductive age in terms of intakes of micronutrients, high contribution for intakes of children. And I think that's an important message, that data is now available showing that it can improve the 1,000-day window. The second key takeaway is that food fortification improves food systems. I think that's very important as well because food systems, as we know, are not delivering enough micronutrients. When you mandate food fortification, a country in essence is forced to enhance public financing for nutrition and food, to improve its laboratory infrastructure, to improve overall policies and regulations in the food system. I think the third major takeaway is that there are a lot of gaps. There's a lot of successes in terms of legislating and scaling up this intervention, but the data show that there's at least 50 countries that could mandate staple food fortification of a cereal grain that have high consumption of that grain and yet have risk of micronutrient deficiency. So there's a lot of work we can do around advocacy and also around compliance. The available data in low and middle income countries indicate about 50% compliance rates. And that is not going to result in health impact. So we need to improve quality and compliance of fortified foods. So those are the major 3 takeaways. It does improve 1,000-day window outcomes. It does improve the food system. And there are gaps, but they can be overcome through compliance building and through advocacy. So I think the report is telling us that there are opportunities to fill these gaps that we just talked about, and that the international partners, government, and donors, including the European Commission, can look to build new programs in countries where they need legislation, can look to improve the compliance and the coverage of these programs in existing fortification programs. And then thirdly, there's a lot that can be done to sustain efforts, actually optimize programming, improve standards, take good coverage to great coverage. So there's a lot of opportunities to build, improve, and sustain, and I think the report helps point a way in how we can do this.